Abend, liebe Teilnehmer und Teilnehmerinnen. Ich möchte Sie alle zu unserer heutigen Depuy Synthes Trauma Breakout Session herzlich willkommen heißen. Mein Name ist Sabrina Paino und ich leite den Bereich Trauma bei Depuy Synthes Deutschland. Und heute als Industriepartner freue ich mich, dass wir Ihnen Innovationen von Depuy Synthes präsentieren können, die Patientenversorgung nachhaltig verbessern. Also von unserem Global Präsident Depuy Synthes Trauma, IB Hall, werden wir nun hören, wie Depuy Synthes die Zukunft der Unfallchirurgie sieht und an welchen neuen Technologien wir arbeiten in Depuy Synthes. Danach wird Graham Hart, so our Depuy Synthes Extremity Lead for Europe, Middle East and Africa, Ihnen zwei innovative neue Produkte vorstellen. So with this said, I would like to welcome and introduce to the audience our Global President for Depuy Synthes Trauma, IB Hall.
Oh, thank you, Sabrina, and good evening, everyone. It's truly my pleasure to join you virtually and discuss exactly what innovation we have moving forward for our trauma team and our trauma business that we look forward to bringing to you over the next couple of years. So I don't want to take too much time from the presenters, but I would like to spend the first couple of minutes at least discussing not only our strategy, but some of the more meaningful innovation that's coming out of the trauma team over the next couple of years. So next slide, please, Graham. We really have four areas or four pillars of innovation that we focus on. And our goal is always to significantly improve the surgeon experience, as well as improving our patient outcomes. And first and foremost, when we look at our innovation, we want to look at our current portfolio and understand that we're always delivering above the standard of care. We know that we have areas to improve. We know that our portfolio is not perfect, but we want to continue to deliver you solutions that will improve our existing nailing platform and obviously our plates and screws, where we know that we've had a long and successful history. We want to continue to lead innovation in that space. So when you think about core technologies to the trauma business, obviously nails and plates and screws, where we're going to see significant innovation over the next couple of years. Even though we have a broad portfolio, we still have some unmet clinical needs that you need to have solutions for to improve patient outcomes. So our goal is to develop differentiated solutions for some of those key unmet needs. Specifically, we want to fight infection. Can we prevent infection with anything we do within our products? Can we help you treat patients with osteoporosis or metabolically compromised bone? Also, usually fixing fractures means you have to get the reduction right. So that also means we have to give you tools and instruments that will help you to improve your ability to reduce fractures, as well as target the implants to make sure that they're held in place accurately and successfully. Not all patients heal correctly. Sometimes there's non-unions or malunions due to biology or mechanics or just extended times to healing. So how can we continue to offer you solutions that differentiate in the way that we can improve those outcomes? And then if we don't follow along with the bone, and we want to say, hey, there's more to this injury than just fixing a fracture, we have to help fix the soft tissues or even the wounds that are around this injury to help improve the patient outcomes. Well, we want to be able to offer those solutions as well. And then finally, patient compliance. We know that you have patients all over the spectrum that we want to make sure that when they are ready to return to movement, that you can count on our devices to help make that happen as soon as possible. So those are some of the key unmet needs we want to focus on. But at the same time, we want to simplify and standardize instead of continuing to always broaden our portfolio and make it more complex. So we want to improve the surgical consistency with intuitive solutions like SPI that is localized there in Germany and continuing to grow. We want to look at our sterile solutions so that you can be more specific in those selections per procedure and make those choices very thoughtfully. And when you use an implant, you know that it's sterile and safe. And then finally, we want to expand our reach and reduce costs. We know that if we want to treat something in Berlin and we want to treat the same way in Zurich and we want to treat the same way in London, we have to be able to standardize not only across the region, but across the world. And that will help us reduce our overall cost to serve. And then finally, as Depuy Synthes, we want to be a good parent, or we want to be a good steward to J&J. How can we continue to use those strengths that J&J offer and continue to get more for bang for our buck? So we want to strengthen our digital and integrated patient care pathways, at the same time strengthening our partnership with AO collaboration across all of our orthopedic platforms. That's our innovation from a very high level. But what does that yield? That always yields new products and new technologies and new solutions. So let's take a look at some of those. So let's start on the next slide, please, Graham. We want to focus on those key unmet needs that we talked about. We just recently released our RIA 2.0, as well as looking at our TrueMatch graft cage to treat large segmental bone defects. These are unique solutions, unique to Depuy Synthes, that we are very excited to bring forward. Not only are they unique to us, but they're also unique to the patient because they can be built patient specific and actually being very custom made to the injury that the patient has specifically with the graft cage. We want to fight infection. You know, this is the #1 complication in trauma surgery. We're very proud of the job that the ETN Protect is continuing to do to fight those infections and tibial fractures. But can we continue to expand that and look at how we can fight infections in any orthopedic injury for any open fracture? You can see the complication numbers, and I'm sure you see it in your patients. And we want to continue to develop new technologies just like the ETN Protect that will help deliver on that promise. And finally, when we want to fixate an osteoporotic bone, you know, cutout of screws in osteoporotic bone or metabolically compromised bone is a huge complication. Up to 36% could be seen in some of the shoulder repairs that we want to fix. And we know it's an expensive revision. So having these solutions where we have augmentation for TFNA and Phelos with our injectable bone cement is a tremendous opportunity, and we look forward to improving those outcomes in those difficult situations. So what other innovations are coming? Well, let's look at what's coming over the next 18 months on these next slides. I mentioned the RIA 2. We've just released our cannulated compression headless screws, as well as our quick insertion screws. The radial head replacement system that will help round out some of our extremities offerings. I talked about the TrueMatch graft cage, but we're really excited about this launch around advanced nailing. We will now, go along with the TFNA and the femoral recon nail, be releasing new retrograde femoral nails and tibia nails over the coming months. So the entire shaft nailing system available to you will be reinvented and have new solutions over the next 6 to 12 months so that you can actually try these out with your new patients. Another addition to our extremities line will be the variable angle clavicle system, as well as a new solution for patella fractures. So as you can see, we're looking not only in our IM nails, our plates and screws, our biologics, and we're continuing to expand all the offerings that we have to you so you can continue to improve your outcomes. So now let me turn it over so we can talk over some of these new solutions that are available to you in the femoral neck system and our cannulated compression screws. Turn it over to Graham to go from there. So thank you all for tuning in, and we're looking forward to serving you into 2021. So thank you very much. Graham, take it away.
Thank you, Ivy. So as Ivy said there, he was looking more at a broader picture. So I'm going to focus in slightly at two of our newest products to the market over the last year and a half to really show how we're trying to have meaningful innovation to solve issues and have a better patient outcome. So the first one here that we're going to discuss is the femoral neck system, or abbreviated to FNS, which is our solution for femoral neck fractures. So when developing a new product, as always, collaborating with the AO, we try to address the unmet needs of a particular fracture. So when looking at femoral neck fractures, these are the common things that we saw which are challenges clinically. So varus collapse because of an unstable construct, femoral head rotation, lateral implant protrusion causing thigh pain, invasive surgical approach, or challenge in implant placement, particularly if you have a very small femoral neck or a small stature patient. So when looking at these clinical challenges, we've seen that these are contributing to a revision rate of approximately up to 18%. And the question here is, should the surgeons and patients accept these challenges, these clinical challenges? At Depuy Synthes, we think no. And this is why we strive to produce implants that will improve the patient outcome. If we look at the femoral neck system here, it comprises of three components. Number one, it has an anti-rotation screw. It provides rotational stability, and it allows the implant placement in small anatomies because it's integrated into the bolt, which is number two. So the bolt, it has a cylindrical design to maintain the reduction on insertion because it eliminates any torque associated with putting in a screw or a lag screw. It provides angular stability, and it also reduces cutout. And then the third part of the construct is the plate, which has a very small footprint and helps provide the angular stability associated with the bolt in place. Now, it's great saying that we've got this implant and we've got these certain features, but we really need to make sure that they're meeting the clinical demands or the unmet needs. So I'm going to try and demonstrate that in the next couple of slides. If we look at the unstable construct, which is causing varus collapse, the design solution for this is the side plate and the 10mm bolt, giving you angular stability between the bolt and the side plate, which is critical to stop varus collapse. And what we've developed is a system that is 100% more resistant to this collapse compared to 3 cannulated screws, and a system which gives comparable angular stability to a 2-hole sliding hip screw. So we're meeting the demands that we need to fix these unmet needs. On femoral head rotation, we have the integrated anti-rotation screw and bolt, 40% increased rotational stability compared to a sliding hip screw. And also a real key aspect, which I've raised a couple of times already, it allows easy implant placement in small femoral neck fractures. If we look at lateral implant protrusion and thigh pain, which can be an issue, we've overcome this through controlled collapse. And not only controlled collapse, but all of the collapse, the dynamic collapse of 20mm is contained within the implant. So you get no lateral protrusion and therefore no thigh pain. And if you look at that compared to, on the left, a sliding hip screw and multiple cannulated screws, this can be an issue and an unneeded issue. If you look at invasive surgical approach, we've got this side plate, which has a reduced footprint compared to a DHS, a dramatically reduced footprint. And we've found that this reduces the incision size by approximately 9mm. So therefore less blood loss, less chance of infection. But not only are we reducing the footprint, we're reducing it without compromising any of the strength of the product. As I stated earlier, it has the same resistance to varus collapse as a sliding hip screw, but obviously a much smaller size. The last challenge And probably one of the most important actually is implant placement. It's the third time I've mentioned it already within smaller stature patients. The design solution here is a one guide wire technique insertion instrument. So basically, all the construct components are inserted through the targeted insertion handle. You have to position one 3.2 millimeter wire center in the head and neck, and then everything is guided across that with the insertion handle. So it should reduce the complexity of the operation. It's not like when you're trying to put in 3 cannulated screws, which all have to be parallel to each other. And you may have to have multiple attempts at trying to put in those wires. It's one wire in the correct position, and then everything works across that to minimize the difficulty. And in this as well, we've also looked at the complexity of the set, and we've reduced the instruments and the surgical steps by 52% compared to a sliding hip screw. Now that's just a brief overview of the femoral neck system, but I really hope that it demonstrates that when we're talking about meaningful innovation and within Depuy Synthes and what Ivy was talking about earlier, we really strive to meet those unmet needs and clinical challenges, because everything that we release to the market, supported by the AO, we want to make sure is going to improve patient outcomes, because that's our true goal. The next product that I'd like to talk about quickly is the cannulated compression headless screw, or abbreviated to CCHS. Once again, we had to look at the clinical challenges, the unmet needs. And these come like this: less effective self-cutting screw tips or ineffective self-cutting screw tips. This gives you an increased risk of far fragment displacement because you have to apply more pressure when inserting them because they're not effective at cutting. You may need to pre-drill, which can result in added cost or added time. The stiffness of a guide wire within cannulated screws is always a bone of contention. If the wire bends or deflects, you may have to have multiple attempts and multiple passes at inserting the wire, and you really lose the sense of depth and trajectory as a surgeon. A limited portfolio is also an area of concern when we were looking into this project, because headless screws are used throughout all bones, hand, foot, femur, different sizes, different fracture configurations. Therefore, you need the breadth of the portfolio to be able to meet these demands. Just as a little introduction into the features and benefits of the headless compression screw. And if you look at these features and benefits here, you could ask the question, is it just a normal screw, another screw? A screw is a screw, we hear said a lot. And actually, if you look at the face of it, you could understand why people might believe that. It's just got a star drive recess, head with cutting flutes, reverse cutting flutes on the tip, self-drilling, as I said, and it works with differential pitch to give you that compression, having smaller pitch on the head and larger pitch distally. However, we don't want just to bring out another screw. Once again, we want to tackle those unmet needs and really provide a better outcome for our patients. So how have we done that? So if you've got an ineffective screw tip, self-cutting tip, as I said earlier, you're going to increase the force of pressure insertion, may have distraction, may have to use a drill. So we've tried to combat that issue with 3 uniquely angled surfaces, which combine to form a very innovative cutting edge. And it looks like this. So our CCHS, we've designed a positive rake angle. And what this means is that it gives you a sharper cutting tip for insertion. If you look at that versus our competitor cutting tips and even our legacy tips, they all have a neutral rake angle. And what this means is that the head of the screw almost has a blunt shape to it or a broad shape to it, and therefore does not cut as effectively into the bone. Now, a saying in the UK where I'm from is that the proof of the pudding is in the eating. And every surgeon that has had their hands on our new CCHS cutting tip has commented on how tangible it is and how you can really feel the difference of that tip cutting through the bone. So we feel that we're meeting the need there. And actually, just a point to add, the first one of these screws that was used in EMEA, Europe, Middle East and Africa, was in Germany. So very happy to be presenting it to you today. The next issue that may be encountered is the stiffness of the guide wire. Now, especially when you're using smaller headless screws, wires that are divergent, because obviously there's less material there, can be a real issue, particularly if you're working on small bones, say like a scaphoid, and you want to put one screw in place. You need that wire to be seated in the correct position, and you don't want to have multiple passes at it. So what we've done as a design solution here is that we've changed the material of our guide wires to cobalt chrome. And cobalt chrome has a higher bending stiffness of 29% when compared to stainless steel, which is the material in which most guide wires are manufactured from. So we really are trying to make sure that when that surgeon has limited space or is using a smaller wire, he can position it confidently and will not have divergence of that wire and complications. The last issue, a limited portfolio. Simple design solution here, having the broadest portfolio on the market with screw diameters from 2 up to 7.5 and having all the threads partially threaded, totally threaded, everything available. Because as I stated earlier, these screws are screws that are used in multiple different bones of different sizes with different fractures. Now, I could hear maybe people saying, well, if you've made the portfolio so broad, is it not going to be complicated? But we thought about that as well. We have modularity of the sets, and also we've maintained that everything is color coded. So if you're using the green screws, they go with the green drills, the green instrumentation. So it makes it very easy and user-friendly. I hope that I've demonstrated a little bit more with how our meaningful innovation within Depuy Synthes is really striving to meet the needs of our surgeons and patients to hopefully give a better outcome for our patients. I thank you for listening.
So, vielen Dank an die Referenten und vielen herzlichen Dank für Ihre Teilnahme. So, ich freue mich, dass heute wir als Industriepartner, als DPS die Möglichkeit hatten, unsere Vision mit Ihnen als Experten im Bereich Trauma zu teilen. Bitte nutzen Sie die Chat-Fragenfunktion im Stream oder gehen Sie über die Nachricht schreiben Funktion direkt auf unsere Firmenrepräsentanten zu. So, noch einmal vielen Dank, herzlichen Dank und Ihnen allen einen schönen Abend mit vielen weiteren spannenden Sessionen.
There's one question in the chat to Ivy. The question, Ivy, is which role will robotics play in trauma in the future?
Okay, thanks. I think that's a great question, and I would say that even today robotics are starting to play a role in trauma. We have started experiments, I would say, with looking at robots for placement of certain screws, whether they're SI screws or even the femoral neck element for the FNS that Graham just talked about. So we are looking at how we can use robotics to be used with a more precise placement of the screws that will play a role for load bearing or even fracture reduction. But I think that's a little farther off. I think what you're going to see from a digital space earlier in trauma is more advanced imaging and visualization. You're going to see the fact that as we get into, we talked about better fracture reduction. We talked about making sure that the patients are not seeing non-unions or malunions. These are some of the things that we can improve if we sit down and provide the surgeons better imaging, visualization, and then some tools that are specific to them for each fracture. So while robotics will play a role in the future, and it's starting to go down that path, I also see a much more digital connectivity in the OR with imaging and visualization tied into the ability for the surgeon to provide better fracture reduction, better implant placement, and more consistently be able to reduce those difficult fractures. And that will hopefully bring those patient outcome improvements that we talked about earlier. But definitely roles for everything to create a digital and connected OR, from imaging to robotics, even to sensors and beyond. But definitely those are all in our innovation pathway, and we'll be excited to bring those solutions in the future.
Thank you, Ivy. Did we collect any other questions?
No, we don't have any more questions in the chat box, Sabrina.
Okay, dann warten wir nur kurz. Es gibt etwas anderes. Wenn nicht, dann noch einmal vielen Dank an die Referenten und vielen Dank für Ihre Teilnahme und Ihnen allen dann einen schönen Abend.